side effects of Symbicort, I think people have targeted Symbicort because now the FDA has approved this so-called SMART therapy. SMART stands for Single Maintenance and Reliever Therapy, SMART. This has been around for a long time. It only recently was recognized or approved in the US, but we were doing it in Europe and Canada, where I've also practiced for years. There's a class of medications called combination inhaled corticosteroid long-acting beta agonist, or long-acting bronchodilator. Now, Symbicort is one of them. Dulera is another one. They're different, manufactured by different drug companies. They contain different inhaled corticosteroids, both equally effective. They contain the same long-acting bronchodilator or long-acting beta agonist, and that's called formoterol. And both of them can be used in the SMART therapy. Advair, the purple one, which I also like, I use a lot of. It's a good drug, been around since the late 90s, but the long-acting bronchodilator in Advair is different than in Symbicort or Dulera, and it is not only is it not approved for SMART therapy, but it's not a choice for SMART therapy. The distinction is the bronchodilator or long-acting beta agonist in Advair is salmeterol, which has a delayed onset of action. The formoterol, that's in Symbicort and Dulera, has a rapid onset of action. They both last 12, maybe 18 hours, and there are some subtle differences in the two drugs. But the point is, for SMART therapy to work, you want to experience rapid relief when you're feeling tightness or in your chest, or when your child is wheezing. And so that's why Symbicort and Dulera are the go-to drugs for that particular way to treat asthma. I typically do that actually not in preschoolers. I'll do it in adolescents. Why? Because adolescents are notorious for only taking their medications when they feel symptoms, and so using a SMART inhaler or the SMART therapy, such as Symbicort or Dulera, you at least know they're getting their inhaled corticosteroid when they're reaching for their reliever, which is the same puffer. They're one and the same. And so they're getting their preventer as well as the relief of symptoms that they seek when they reach for their puffer. Preschoolers don't feel, I stand correct, they feel symptoms. They definitely feel symptoms. They just don't articulate it. And sometimes all that a parent can do is sort of watch and think, jeepers, are they experiencing some symptoms? So I would not advise SMART therapy, or I would not necessarily use either of those inhalers in a preschooler. And in fact, even some school-age children aren't very good at reporting symptoms. I mean, I typically, my personal bias is not even to employ SMART therapy until adolescence. And that's why I still use a lot of Advair, because I want the child to get their preventer medication twice daily, every day, whether they feel well or whether they feel ill. And yeah, that's the difference.